Well, good afternoon. We've been working through the entire summer to put together a comprehensive plan, to put the necessary resources in place and build the capacity we need to be ready for another wave of COVID-19. With the number of cases on the rise, it's clear that the next wave, it will come at us harder than the last one. It will be more challenging than before because the flu season is starting soon and people are heading indoors again. We're also tackling a backlog of surgeries and procedures. We want to avoid canceling those at all cost. These patients and their families, they're counting on these surgeries. And I'll do everything in my power as Premier to make sure these patients get the help they need, because we need to clear the backlog, and I will have more to say about that in the next few days. And at the same time, we need to ensure our hospitals are not overwhelmed by the next wave of COVID-19. Preparing for the second wave, it's our top priority. It's what we've been working on around the clock all summer long. Folks, we haven't taken a break. And today, we're sharing this part of our comprehensive fall preparedness plan. It sets out the steps required to deal with the second wave and keep our healthcare system strong. It's a plan informed by our health experts, the Chief Medical Officer of Health, and the entire command table. Given the size and the scope of this plan, we will take the next few days to walk through it, so each and every person understands how we're putting their health and safety first over the coming months. This is a plan that will ensure we can continue to count on our healthcare system when we need it most. And today, I'm proud to share the first pillar of our plan. The first pillar helps our hospitals maintain capacity through the use of the flu shot. The flu shot helps reduce visits to our emergency rooms and doctor's offices during this season. And this will help with keeping capacity in our healthcare system. That's why we're investing $70 million to deliver the largest and most comprehensive flu shot campaign in Canada's history. We've ordered 5.1 million doses for the entire province, and we're working to order even more. Anyone who wants a flu shot can get one. I'll repeat that. Anyone at all who wants a flu shot this year can get one. And I encourage everyone to please get their flu shot this year. It's absolutely critical. Folks, we need your help. It's the best way to protect you and your family, because the next few months will be critical. We know that a second wave is coming. We know that it will be more complicated than the first wave. We know it will be more challenging on the system. What we don't know is how bad it will be, how hard we will get hit, because that's up to all of us. We all have a part to play. And it starts with everyone getting their flu shot this year. So please, please make sure you get yours. It's never been more important. And as always, flu shots will be available in the coming weeks through your family doctor and at your local pharmacy. We're making high-dose flu shots available to seniors for the first time ever in pharmacies. And we're prioritizing them for long-term care homes, retirement homes, and hospitals to protect our seniors and most vulnerable. My friends, there's no excuses. We all have to do our part and help our frontline heroes by getting our flu shot. And that's why dramatically increasing flu testing this year is such a critical part of our fall preparedness plan. And I'm looking forward to releasing more about our plan over the coming days and weeks, because this plan, the steps we take as a government, our collective actions as a people, it will make all the difference in the world. And by working together, we can all stay safe and healthy and defeat this virus. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. For the past several months, our government has been hard at work to protect the health and safety of all Ontarians and ensure the health system's readiness for future waves of COVID-19. We've been working directly alongside our partners on the front lines to validate and improve this comprehensive plan. It's a plan focused on 6 key areas. Number 1, maintaining strong public health measures, including continued expansion of testing and case and contact management. Number 2, implementing the largest flu immunization campaign in Ontario's history. Number 3, quickly identifying, managing, and preventing COVID-19 outbreaks. Number 4, accelerating efforts to reduce health service backlogs. 5, preparing for surges in COVID-19 cases. And 6, recruiting, retaining, training, and supporting healthcare workers while also continuing to engage families and caregivers. Given the size and complexity of our fall preparedness plan, we will release details over the coming days, including the considerable progress already made in the plan's ongoing implementation. While our best defense continues to be our everyday actions to stop the spread, like physical distancing, face coverings, and staying home when ill, even with minor symptoms, we want to be prepared for any scenario. Flu season presents a new challenge to Ontario's response to future waves of COVID-19. The flu shot provides the best defense and has proven to reduce emergency department visits and wait times, helping to preserve hospital capacity for any surges in COVID-19 patients. That's why we're investing almost $70 million in flu shots to launch the largest and most comprehensive flu immunization campaign in Ontario's history. This campaign includes ordering 5.1 million flu vaccine doses. That's 700,000 more than the approximate use last year, with 1.3 million high-dose vaccine doses for Ontario's seniors. To make it easier for seniors to get vaccinated, this year, for the first time, the high-dose flu vaccine will also be available at participating pharmacies. I encourage everyone to get their flu shot when it becomes available in the coming weeks at family doctor and nurse practitioner offices, public health units, and participating pharmacies for anyone 5 years of age or older. Our government's top priority is to protect the health and safety of Ontarians. I look forward to sharing with you more details of how our plan is going to do this over the next several days. Thank you.